And joining us is Tricia Atzker-John, our Director of Health Services here in Keller ISD. So, Tricia, what does health services look like as we're opening up a new school year?
It looks a lot different. We are working through a lot of different plans. We're working beside every department: athletics, student services, nutrition services, transportation, special education, language acquisition, developing plans so that they can safely bring their small groups in to begin their assessments and strength and conditioning, whatever it is that they're working on. That gives us a great opportunity to work through some bugs, if you will, through all of their unique situations so that we can see what that will look like on the grander scale.
So, and I'm glad you brought that up. This is not just planning for August. You've already been, from your level of expertise, working through a lot of these things because we've had things going on to some extent throughout the summer with our kids.
Absolutely. We have been in it with the district since spring break and even before that.
So the day in the life of a school nurse probably shifted a little bit once spring break hit, obviously. Obviously we weren't back in the buildings at all.
Right.
But even now, what are some of the responsibilities that the school nurses are having to figure out how to adjust to in terms of their day-to-day work?
Our overarching concern is taking care of those students safely who come in every day for their meds, for the diabetes care, maybe that special procedure that needs to take place. How do we do that safely and keep them away from students who possibly are coming to the clinic for an illness?
Right.
We are working with a small group of nurses right now, developing a document that will help guide those conversations at the campus level.
Great.
So that each campus can develop their own plan, what works for their campus, their students, what talent do they have among their other staff members that they can tap into. The campus nurse will obviously be there to support and field questions along the way. However, students may receive their medications in a different location and maybe with someone else other than the nurse during the school day.
And that might look different at every campus depending on the situation that we're in. It's funny that you mentioned that because we talk a lot about how we're the experts in education. We know instructional models, we know how to do that, but we have a medical expert on every single campus who can help guide some of this training that the teachers are going to have to be aware of in terms of symptoms and different things that they're looking for.
Absolutely.
So they're definitely an on-site level expert. So I know we've received a few questions about immunizations and some of the requirements that we have to have done prior to entering school. So how has the world of COVID changed that?
There have been no changes.
Okay.
Immunizations are expected as usual, and the reason for that is herd immunity, which is just our safety net to help protect us and our other students, the most vulnerable, from pertussis, measles, those kind of things. If we let our guard down with some of those tools that we already have and are proven effective, that's just waiting to be a problem when we come back. We've got enough to deal with.
Yeah, right.
Let's keep with what we know.
No doubt. So what happens if a student or a employee is suspected of having COVID-19?
We will immediately begin that contact tracing. They will be taken to another area that, again, is designated by the campus where that might be. Start that contact tracing, start cleaning any areas that are identified that need to be cleaned, notifying people that need to be notified, and support that person until they can get off campus.
And then how are we going to notify parents about cases that happen on campus?
That will be guided by the health department.
Okay.
We could work through a whole host of scenarios on different situations.
Right.
But the foundation will rely on that contact tracing both on the school district side and on the community health side, and attendance records, and those daily health screenings that I'm sure we've all heard about. All of those things will come into play as we decide who needs to be notified and when.
So one of the things that comes up is the identification of COVID symptoms, but if you look at that list of COVID symptoms, they look remarkably like just about any other symptom to an illness, whether it's the flu or the cold. So how are our nurses being trained on if we have a potential COVID case versus a student that comes down potentially with a fever, but it's not a COVID case? Is there going to be a way to separate those kids in the clinic?
Absolutely. A lot of that will come from the dialogue, that conversation around COVID. What are your risk factors? What have your activities been? Has anyone in the home been sick? You may have a kiddo that comes in, has headaches routinely.
Right.
Well, just because they have a headache and it's listed on the list of COVID symptoms doesn't necessarily mean they've got COVID right out of the gate. Let's investigate and find out what the root cause might be. And according to the CDC, they really use 2 symptoms off the list as kind of a guideline. So if you have fever and a sore throat, yes, that could be strep or any
Right.
other number of things. But again, we're going to automatically kind of go down the path of COVID until proven
Until it's
otherwise.
proven otherwise. Okay. So what else would you like to do, just in closing? What would you like to tell the families about the work of health services, just to ease their minds a little bit?
Well, the nurses are ready, armed. They're excited to get back into the buildings. They miss the kiddos as much as the teachers do.
Sure.
And they are just really working hard out there in different initiatives. They're right now checking shot records and communicating with parents who need to provide additional information around their shots so that we can be prepared to deliver that online learning platform
Great.
on August 19th.
Great. Well, thanks for everything you and your team are doing across the district, and thanks for joining us.
Well, thank you.